Welcome back, everyone, to another essential training module in our Explainer series. Now, if you are a revenue cycle management professional handling complex surgical denials, you are in exactly the right place. Today, we're taking an expert-level look at one of the most common, and frankly, sometimes the absolute most frustrating types of denials they'll ever face. I'm talking about the global surgery package and post-operative period denials. Yep, those pesky N525 and M144 codes. If you've ever felt like you're just banging your head against a brick wall trying to get these claims paid, well, get ready because we are going to unpack exactly how the billing systems process these, and more importantly, how you can successfully overturn them. Okay, let's dive into this. We've got a tight agenda today. First, we'll cover the concept and definition. Second, the root cause analysis. Third, our step-by-step resolution workflow. Fourth, a standard AR caller note template. And finally, we'll wrap up with a quick knowledge check. Starting off with Section 1, Concept and Definition of the Global Surgical Package. Before we can even start calling payers and appealing denied claims, we really have to understand the foundational rules of the game here. Establishing this baseline knowledge is literally the key to successfully overturning these claims in your billing system. So what exactly is a global surgical package? Well, think of it like a bundle deal. It's a single payment for all care associated with a surgical procedure, which bundles the normal post-operative care into the main fee. Basically, the payer views the surgery and the standard recovery care as one single continuous package, rather than individual billable events. If a surgeon operates on a patient, the insurance company assumes that surgeon is also going to check on that patient's recovery. They pay for it all upfront in one lump sum. And that single payment is actually based on 3 distinct phases of care. First, you have the preoperative evaluation. Second, the intraoperative procedure, the surgery itself. And third, the postoperative care. Now, the numbers 0, 10, or 90 days denote the length of that postoperative window, and it varies depending on the specific surgery code. So a minor procedure, like a simple biopsy, might have a 0 or 10-day global period, while a major joint replacement almost always has a 90-day global period. You need to keep 0, 10, and 90 locked in your memory for sure, because it is going to come up constantly when you're working these claims. When a claim gets denied, you're typically going to see one of 2 remark codes on your explanation of benefits. N525 literally translates to, "These services are not covered when performed within the global period of another service." M144 is pretty similar, stating pre- or post-operative care payment is included in the allowance for the surgery or procedure. When you see N525 or M144, the payer's automated system has essentially thrown a giant red flag on the play, basically saying, hey, we already paid for this when we paid for the surgery. Moving right along to Section 2, let's look at the root cause analysis to see exactly why these denials occur. Imagine a doctor examining a patient's knee during a routine post-operative checkup. Denials happen when follow-up procedures or evaluations fall directly within that 0, 10, or 90-day global window we just talked about. The insurance system sees a date of service that sits right smack in the middle of a prepaid recovery period, and it just automatically blocks the payment. So, the crucial point here is this. A denial triggers when a provider bills for a related follow-up visit or an evaluation and management service for the same condition without properly appending modifiers. Modifiers are essentially special codes that tell the payer, yes, I know this is within the 90-day window, but this visit was actually for a completely different reason. It is incredibly frustrating to lose perfectly valid revenue just because 2 little digits were missing, right? But if those modifiers aren't there, the claim is instantly bundled and denied. All right, Section 3. Here is your step-by-step resolution workflow and decision tree. Before you ever pick up the phone to call an insurance representative, you absolutely must complete these 3 verification steps in your billing system or clearinghouse. Step 1. Check the patient's history. Was any surgical procedure performed up to 90 days prior to the current denied date of service? Step 2. If yes, identify that surgery's specific global period. Is it a 0, 10, or 90-day code? Did today's visit fall within that specific time frame? Step 3. Look at the diagnosis codes. Does the diagnosis for this follow-up visit match the diagnosis from the original surgery? Once you've done that research, you're going to find yourself in one of 2 scenarios on this decision tree. In Scenario 1, you discover the current visit is totally unrelated to the prior surgery, or the diagnosis codes are just completely different. In this case, you call the payer representative directly and request they reprocess the claim because their system made a mistake. But in scenario 2, you find the care is highly related and falls squarely within the global period. Here, do not call the payer yet. Seriously, save yourself the 45-minute hold time. You route this directly to your coding team for review. They need to verify if a modifier, like modifier 24 or 79, can be legitimately applied to separate the service, or if the healthcare provider just needs to take a write-off. Next up, Section 4, our standard AR caller note template. If you do have to call the payer or send a claim back to your coding team, proper documentation is everything. A professional standardized caller note must include the date of service, the billed amount, the original claim number, the specific action taken with the payer representative, the exact denial code like N525 or M144, the verified global period of 0, 10, or 90 days, the next steps for resolution, and always get a call reference number. Having a clear, concise, and properly anonymized documentation format saves massive headaches for your team down the line. It literally tells the exact story of the claim at a single glance. Finally, Section 5. Time for a quick knowledge check to see what stuck. Question number 1. What are the 3 standard lengths of time for a post-operative global period? Is it A, 15, 30, and 60 days, or B, 0, 10, and 90 days? Question number 2. Which remark code specifically states, these services are not covered when performed within the global period of another service? Is it A, N525, or B, M144? And finally, question number 3. In scenario 1, if the diagnosis codes completely differ between the prior surgery and the current follow-up visit, what is your next immediate step? Is it A, route to the coding team for a modifier, or B, request direct claim reprocessing from the payer? All right, let's see how you did. Number 1 is B. The global periods are 0, 10, or 90 days. Number 2 is A. The specific code is N525. And number 3 is B. If the diagnosis codes differ, your immediate step is to request claim reprocessing. If you got all 3 right, you are well on your way to mastering these denials. Understanding how payers bundle surgical care and having a rock-solid workflow to untangle those bundles is exactly what separates average billers from true RCM experts. Next time you see an N525, you'll know exactly what to do. But before you go, ask yourself this: how much revenue is currently sitting in your aging buckets just waiting for a modifier 24? Share and subscribe for free courses on Decode Healthcare with Harshal. Keep learning, keep pushing for accurate reimbursements, and I will see you in the next explainer.